to talk about the COVID situation in the country at this point in time. Amidst the third wave, the big concern now is many of the southern states which are seeing a huge spike in the COVID cases. 7 out of 10 COVID caseload districts are in South India. These are from Karnataka, Tamil Nadu, as well as Kerala. Bengaluru still remaining a big cause of concern. It is contributing a high number of cases as well. Union Health Minister, meanwhile, will be chairing a meet to review the COVID situation, especially in these states which are contributing to the caseload at this point in time.
The Union Health Ministry is tracking the COVID case rise in the southern part of the country. Out of the top 10 districts which are contributing large number of cases, 7 districts are coming from southern part of India. The state of Kerala remains a concern because the cities like Ernakulam, Kozhikode and Trivandrum are contributing significant chunk. Bengaluru urban is having the highest number of active cases in the country right now. Karnataka has peeped past Maharashtra in terms of active cases. So the concern is there for the southern states, and the Union Health Minister is also meeting the state representatives to chart out a plan as to how the case rise can be curbed.
Let me, in fact, go across to Neha, who's joining us for more details to get a sense of the situation in Karnataka. Neha, what can you tell us at this point in time? Karnataka has been seeing a significant spike in cases, and specifically Bengaluru has been a big contributor of that spike that the state is seeing.
Yes, absolutely. Avni, if we look at the absolute numbers of cases right now, Karnataka has, of course, been reporting a high number of cases. It had touched even 50,000 last week. And now, as of last evening, we're seeing the cases coming down to 38,000. But, like a lot of experts have said, it's not right to look at the absolute figures, but the positivity rate. So let's tell you about the positivity rate, both in Karnataka as well as in Bengaluru city. The positivity rate stands at about 19% right now. This is, in fact, a drastic change and a good and a positive change for Bengaluru city if we talk about, because let's tell you that just 4 days back on, in fact, the 24th of this month, we saw how the positivity rate had shot up to 32%, and now it's come back down to 19%. So definitely, a sign that things are getting a little better. But yes, having said that, while of course one may term this as worrisome, the experts over here in the state of Karnataka do reiterate that as of now, the relaxations that have been permitted for the state, will stay put. And whether there's going to be more relaxations or not, that is something that will be deliberated upon tomorrow, where there's a meeting that's being held. The meeting, of course, would largely focus on whether or not schools are likely to be reopened or not, because at this point, 19% of positivity rate, is probably something that the government would, of course, be discussing. So another point of concern, Avni, that was going to be discussed today in the meeting of the State Health Minister and Union Health Minister was that there are a lot of people that are dying in home isolation, especially senior citizens. So this is a question that, of course, has been raised multiple times as to why, when many, many hospital beds are lying vacant, why are patients dying in home isolation? So that is also something that's, now, of course, going to be deliberated upon. But on the whole, it does seem like the situation, at least in the state of Karnataka, is looking slightly better than what it was last week.
All right, Neha, well, that's the situation as far as Karnataka is concerned. But let's also get a sense of what's happening in Kerala as well. Vivek is joining us for more details. Vivek, as far as Kerala is concerned, even earlier on, it has seen a significant number of waves, in fact, so to speak, with multiple times that the cases have risen. What can you tell us about the situation at this point in time?
Yes, at this point of time, it is indeed a matter of concern because 51,000 COVID cases, 51,378 COVID cases have been reported as of yesterday. And the positivity rate has touched up to 44.60. But what is, come as a relief, when compared to the second wave is that the number of people who have been admitted in the hospitals is comparatively less. Now, if you look at the total active cases, that comes up to 3,68,540. Now, this is somewhere near that. I'm not saying an exact figure. But the number of hospitalization here is just 3.8% of the people have been isolated, and of the active cases, only 0.3% have now been depending on ICU beds, and 0.7 percentage are receiving oxygen support. So basically, the number of people whose situation has turned a bit complex are very, very less as compared to the second and first wave. But as far as the number of cases are concerned, the last 1 week, if you look at the number of cases, it's touched the 55,000 mark at one point of time, and once again it touched 50,000. So the cases have been crossing the 50,000 mark, for the last 1 week, which is indeed a matter of concern, and that is something which the health minister has clearly said yesterday. Of the total cases, 94% of the cases that's been reported are Omicron variant, and it's only the rest 6%, which is the other variant of COVID that's been reported. Now, and also remember, the health minister is in constant touch with the district medical officers across the state. As far as the number of cases in the state is concerned, Ernakulam and Thiruvananthapuram are reporting the highest number of cases. Ernakulam, on a daily basis, it is crossing the 9,000 mark, and Trivandrum is crossing the 8,000 mark. Now, if you look at the hospital availability, the bed availability in Trivandrum district alone, around 51% of the beds are still not occupied. Now, basically, also what we need to be understood here is that the TPR based model has not been adopted right now, and now that is now changed to they are checking as how many people have been hospitalized in a particular zone, and that is a that is how the health department is gauging the intensity of COVID spread as of now. And also remember, the districts have been divided into A, B, C category. Now, 7 districts have come under category C, where only essential shops and medical shops are allowed to open. No theaters, no gymnasiums, and no crowded places allowed for marriages and for death ceremonies. It's only 20 people that's been allowed, which is strict COVID restrictions are on place right now. Yesterday there was a meeting that has been conducted, and the government has decided that all the examinations will be cancelled. Only online examinations will be happening, and also the 10th and for the 12th and the graduation exam, the final examinations of the graduation will be happening. And apart from that, every classes right from 1st to 10th standard are being conducted through online. Back to you.
All right, Vivek, thank you so much for joining us with all of those details. That's the situation as far as Kerala is also concerned.